Good evening. My name is Gertie. I am the nurse manager. What you are about to view is an example of hourly rounding and the bedside report in an S-bar format. Bedside shift reports increase trust and safety by involving patients and their families in the plan of care. So let's get started.
Okay, Mr. Daniels, my shift is coming to an end and I will be leaving. The oncoming nurse and I will be coming in soon to give bedside report. We encourage you and your wife to be involved in your plan of care for the next shift. We only have a short time to give report, so is there anything I can do for you now? I have the time. How is your pain? Would you like to go back to bed?
My pain is fine, thank you, Max. I would like to stay in the chair a while longer.
Okay, do you need to use the restroom?
No. The nurse assistant was just here a moment ago and helped me with that.
Okay, I see you have everything you need then. Remember, you are at risk for falls. Mrs. Daniels, will you remind your husband to use the call light to have us help him get back to bed when he is ready? I will be back in a few minutes with the oncoming nurse.
Yes, he will. Thank you, Max.
Okay, I will be back soon with your night nurse, Maya. Hello, Mr. and Mrs. Daniels. As I mentioned earlier, I will be giving report to the oncoming nurse. This is Maya, your nurse.
Hello. It is nice to meet you both. I will put my name on the board to help you remember it.
So Maya, this is Mr. Jack Daniels. He is a 78-year-old gentleman who lives at home with his wife, Mrs. Helen Daniels. Last night he was found down by his wife in their bathroom. 911 was called. Upon arrival in the ED, he was found to be in a fib with a rapid ventricular rate of 150 to 160. He also had lower extremity swelling for the past 5 days with increased shortness of breath and weakness. Additionally, they noted that he has been having tarry stools for the past week. Mr. Daniels is also being monitored for cirrhosis and alcohol withdrawal syndrome. His last drink was at 10 p.m. last night. Mr. Daniels says he usually has 1 bourbon, 1 scotch and 1 beer every night. Is that correct, Mr. Daniels?
Yes, I am bad to the bone in that way.
Oh heck.
No further bloody stools since admission, but he has been started on lactulose 3 times a day for elevated ammonia level of 90. He has had 2 doses. He also had 2 boluses of diltiazem for his heart and was started on a drip that was discontinued this morning and is now on PO diltiazem. He has 2 peripheral IVs, a 20 gauge in the left hand and a 18 gauge in the right forearm, which is PRBC unit 2 of 2 currently infusing.
May I take a look at your IVs?
Sure.
Do you have any pain or tenderness with your IVs?
No, they're okay.
Both 4s were started in the ED. Mr. Daniels' medical background is hypertension, GI bleed, and he had an MI 2 years ago. There is a core measure of CHF with a recent ejection fraction of 39%. All this is on the S-bar. You can take a look at these a bit later. He is allergic to penicillin, which causes a rash.
I see you have an allergy bracelet for penicillin on. Excellent.
Yes, I am wearing the bling.
Going over Mr. Daniels' labs. His BNP in the emergency room was 1700. 80 milligrams of Lasix was given. I removed his Foley at 10 o'clock this morning. His total intake is 550 cc's and he has urinated 600 cc's for a total output of 850 for the past 12 hours. The potassium was 3.3 and I replaced with 20 milliequivalents per the K protocol. Troponin was negative ×2, but the 3rd test will be drawn for you at 2100. His last vital signs are 98.9 temp. Heart rate 60 to 80. BP was 132/58 and the oxygen set of 92% on room air. Hemoglobin on admission was 6.9. The last hemoglobin was drawn at 1300 and was 7.6. This unit of PRBC is 2 of 2 and was hung at 1630. The next H&H will be at 6 a.m. along with his other morning labs. Your blood bank form is in the black binder.
Lovely.
In other assessments, Mr. Daniels has been alert and oriented on my shift. No signs of tremors. His abdomen is soft with positive bowel sounds in all quads. Now let's go over Mr. Daniels' plan for care. Plan of care number 1 is the dysrhythmia. As I mentioned, his rhythm is a fib with a controlled rate on diltiazem, which we need to continue monitoring along with these labs, and you will have another blood draw after this unit is completed, Mr. Daniels.
Well, isn't that just dandy?
Hack.
So it looks if Mr. Daniels' rhythm continues to be controlled, we can resolve this care plan in the morning.
Yes, that is correct. Plan of care number 2 is GI bleed, which, as we stated, will continue to monitor the blood infusion and your vital signs and lab values. Plan of care number 3 is alcohol withdrawal. As I said, there has been no signs or symptoms of tremors, but his last drink has been about 21 hours ago. There is a round-the-clock order for Ativan and another banana bag infusion in the medication profile. Social service has been consulted. Care plan number 4 is CHF. The CHF education on LASIX needs to be reviewed, and I am endorsing the daily weight education to you. Lastly, plan of care number 5 is risk for falls. Remember, he was found down at home.
I see you have the yellow socks on. Do you know, sir, why we have given you yellow socks?
Because it isn't my color wheel.
Hack. Yo know we. The socks are to alert people to help you when you get up. Remember your fellas need.
It is important that all staff know you're at risk to fall, Mr. Daniels. Because you fell last night, likely due to your heart rate and low blood values. It is important for your safety.
Yes, I know.
Mr. and Mrs. Daniels, it has been my pleasure caring for you today. I will be back in the morning, but I am leaving you in good hands with Maya.
Thank you so much, Max. You have been so wonderful, and explained everything so well.
Yes, Max. I want to thank you for all your help, too.
I have a couple more patients to get report on. For your safety, please use your call light to get help before getting out of the chair. The CNA or myself will be back to round on you in about an hour. Do you need me to bring you anything when I come back in?
Well, 1 bourbon, 1 scotch, and 1 beer would be good.
Oh, hack.
As you can see, Bedside Report improves communication with patients and their family and results in improvement of patient satisfaction. Early rounding with a purpose also increases patient satisfaction and clinical outcomes, while decreasing call light use, patient falls and skin breakdown.